Sprained your foot? Don't panic, a 5-minute fix is coming right up. Okay, so you've just sprained your foot. The first thing you want to do is stop. Don't try to be a hero and walk it off. Take a seat and assess the situation. Is your foot at a weird angle or experiencing intense pain? Head to the ER immediately to rule out fractures or serious ligament tears. If it seems like a typical sprain, we can start with some at-home care. The goal is to minimize further damage and get those healing vibes flowing. We're going to focus on reducing swelling, supporting the injured area, and giving your body the best chance to recover quickly. So, let's dive into the steps you can take right away. You've probably heard of the R.I.C.E method, and for a good reason. It's a simple yet super effective way to treat those pesky sprains. R.I.C.E stands for rest, ice, compression, and elevation. First up, rest. Stay off that foot as much as possible for the next few days. Next, ice. Apply an ice pack wrapped in a thin towel to the injured area for 15 to 20 minutes at a time, every 2 to 3 hours. Now, compression. Grab an elastic bandage and wrap it snugly around your foot and ankle. And last but not least, elevation. Prop that foot up on a pillow or stool, so it's higher than your heart. Remember, consistency is key with R.I.C.E. Keep it up for the first 48 to 72 hours after your injury for the best results. Let's be real, sprains can be a real pain. Literally. Over-the-counter pain relievers like ibuprofen or naproxen are your best bet. They not only tackle pain but also help reduce inflammation. Always follow the dosage instructions on the label. If you have any underlying health conditions or are taking other medications, chat with your doctor before taking any pills. Stick with ice for the first couple of days, and then you can gradually introduce some gentle heat if it feels good. Remember, pain is your body's way of telling you something's not right. Listen to your body and don't hesitate to reach out to a healthcare professional if the pain is severe or doesn't improve. Once the initial pain and swelling have calmed down, it's time to start gently coaxing your foot back into its normal range of motion. We're not talking about any intense workouts here, just some easy stretches to improve flexibility and prevent stiffness. One of my favorite stretches is ankle pumps. Simply point your toes up and down, then point them away. Repeat this for about 10 to 15 repetitions, a few times a day. Another great stretch is ankle circles. Rotate your foot clockwise and counterclockwise, making small circles with your toes. Aim for 10 to 15 repetitions in each direction, a few times a day. These gentle movements help increase blood flow to the area, which promotes healing and reduces stiffness. Remember, listen to your body, and stop if you feel any sharp pain. The goal is to gradually regain mobility, not push yourself to the limit. It's super important to know when it's time to call in the professionals. If your pain is severe, doesn't improve after a few days of home care, or you notice any numbness or tingling in your foot, it's time to schedule a visit with your doctor. They can properly assess your injury, rule out any fractures or ligament tears, and recommend further treatment options if needed. Ignoring persistent pain can sometimes lead to long-term complications. Be proactive about your health, and don't hesitate to seek professional medical advice when necessary. So there you have it, your 5-minute fix for a sprained foot. Remember, these tips are designed to provide initial relief and support your body's natural healing process. Listen to your body, be patient with your recovery, and don't hesitate to reach out to a healthcare professional if you have any concerns. Have you ever sprained your foot? What home remedies have worked for you? Share your experiences and tips in the comments below. Subscribe to my channel for more evidence-based health tips and tricks, and hit that notification bell so you never miss an upload. Thanks for watching. Remember, these tips are for minor sprains. If you have any doubts, always consult with a healthcare professional. Don't forget to like, subscribe, and hit the bell icon for more health tips.